Hi, just coming on here to give a little update about the timing of orthodontic treatment for children. Because increasingly in our clinic, we've been seeing a number of kids coming to us that are coming to us a little bit too late. And they've been coming with problems that really should have been identified much younger, much earlier. Because we're seeing these problems later, it's becoming quite difficult to correct those problems for those patients. And I thought it might help to just shed light on a few common things that we've noticed. So one of the key things that we've seen is children with impacted teeth coming to us maybe in their late teens or mid-teens for teeth that really should have been identified as coming through at around 8 or 9 years of age. There are specific things that as part of your checkup, your dentist could be checking for you. Like, for example, here you have your upper canine teeth, and as they come through, the dentist can feel for those, and they should be palpating and checking for those teeth. But increasingly, these children are sometimes not getting the checkups that they need, or x-rays aren't being taken at the appropriate time, and so it doesn't get detected till they're in the teenage years, when it's a lot harder to correct. So really, it's important to be checking for the development of teeth. Other problems we've seen are children coming to us with bite problems that have caused gum problems or gum recession. And really a 6 or 7-year-old child should not have gum problems, should not have gum recession. But because they've got an overbite or a traumatic bite, that has resulted in some kind of trauma to the gum and recession to the gum tissue. So if your child's getting soreness around their gums and it's not related to their hygiene, really ask your dentist whether maybe you should be getting a referral to an orthodontist to see if that can be improved with a bit of treatment at an early stage to make that bite a bit better for the gum. Then other challenges we see are children that have got big overjets or big overbites where the teeth are prominent. Now, most of the time, that kind of scenario involves some kind of discrepancy in the alignment of the jaw. And usually we can, as orthodontists, do some treatment to try and encourage the lower jaw to come into a more favorable position. But it's really important to time that treatment so we capture the child as they enter into their main adolescent growth spurt. And there are things that we can do as orthodontics to assess for that. So for example, we can assess on their x-ray what's happening with their spine, and gives us a good indication or a good predictor of when that child's about to go through the main growth spurt. And that's something that an orthodontist can do. And then another challenge that we've had is where we've had patients that have got very narrow jaw, which has resulted in quite a narrow bite or a cross bite. And these things are really difficult to correct when they are older teenagers. And if we need to do expansion for a patient, expansion is much easier to do in an 8 or 9-year-old as opposed to a 15-year-old. So a few sort of takers, a few pointers on some of the things that we look out for. And really the take-home message is try to make sure you get your child seen by an orthodontist by at least 7 or 8 years of age. Too often it's being left too late. So try and get in to see an orthodontist. Now I know that's difficult in places where NHS provision is under sort of tight pressures and there's not very much in terms of NHS capacity for early treatment. But if you can see a private orthodontist, that can certainly help, because at least you'll be put on the right pathway as to whether something needs to be done now or whether it can wait. So hopefully you found that helpful. If you enjoyed the video and you think it's of help to anyone else, please like it and share it, and I hope to see you again soon.